Okay, so so we're all set for recording now. So I'd like to welcome Kit and Becca back. They've presented before for us, and also like to welcome Norma, their supervisor. We're all from the Senior Medicare Patrol Hawaii, and again, our presentation today is on volunteering, feel the power, and make a difference. So I hope everyone, all the seniors here, take heart. I think this is really important that we get our kapuna involved to help other kapuna with these topics, right? To help promote Medicare. Okay, thank you very much. And so, without any more delays, I'd like to present that Kit and Becca or Norma, if you guys want to say anything before we start.
Sure, thank you. Aloha, everyone. Thank you, John Banagin and Michelle Pagaduan, our two key contacts for Kaiser Permanente in our community education health prevention unit throughout the state. Thank you so much to Kit and Becca. We'll be introducing them formally in just a moment. We are the Senior Medicare Patrol Hawaii program. We are probably more than just a program, we're a movement. SMP Hawaii is one of 53 or 54 chapters throughout the United States and U.S. territories of Guam, Puerto Rico, and the Virgin Islands. We are here going on our 25th year next year. So we've been here since 1997. What we do is we help prevent, detect, and report with you, not just Medicare beneficiaries, but soon to be retirees and those that will be taking advantage of the Medicare program, your ohana, as well as caregivers, to arm ourselves, to avoid ourselves from being statistics, from being duped and scammed with respect to our monies, our hard-earned cash, our hard-earned reputation, and ultimately our family tree and legacy. So we've got a pretty big mission, but we are very, very, very proud and honored to be able to help you and also to enhance our community, which is just incredibly unique and precious that we are lucky to call home. We are spotlighting volunteerism with SMP because without the volunteers, we wouldn't have this program. It is volunteer-based, volunteer-inspired, and volunteer-led and informed people who understand the need to be both professional and timely in helping kupuna, as well as to always continue to learn, because Medicare is always slightly changing every year, as you know. So next slide, and we think we'll be able to finish in about 30 minutes and field some questions. So I really want you guys to understand we're not really here to solicit for volunteers just because there's nothing else to do, but to really pick, really select how you want to spend some of your time to empower the community and empower the lives of the ones that we live with here when we go about our day. Who are these people? Who are these fellow residents? How can we help them? And as you know, when there is more giving in your life, you obviously receive more in happiness. So to start us off, we're going to introduce Kit Sakurai, who's been with us for the last 3-4 years. She comes in the way of retail management, customer service. She was already a volunteer in in a few other programs before she joined SMP, but it's her love for caring about the community, and also too that she's a pretty veteran caregiver, knowing full well the demands and the honors of working with her mother and her spouse, really working hard to caregive for them. And for many of us baby boomers, we don't know who's going to care for us, right? We might have a plan for long-term care residents, but we admire Kit's zeal and diligence to take the time to share with you her mana'o, her reasons for sharing this gift of volunteering with us today. We also have Becca Yoshikawa, who just joined us in November and has been pioneering a few activities with us, including website design and content. She's never done it before. She comes by way of a lot of administrator work with big companies such as Hilton Hotel, Queens Healthcare System, Kamehameha Schools, Bishop Estate. And so we're very, very fortunate to have her experience with us. So we'll have Kit start us off and then Becca, and we can go into the next slide here. I'll take it away, Kit. It's all yours.
Thank you, Norma. Good morning, everybody. So who are the SMP Hawaii? Like Norma said, we are a volunteer-based, federally funded program. And our mission is to empower and assist Medicare beneficiaries to help them to prevent, detect, and report healthcare fraud, errors, and abuse, And we do this by doing outreach programs, doing counseling sessions and education programs like today. Oh, I just lost the PowerPoint.
Let me see if I can get the PowerPoint back there. Just a moment.
Okay, so right now, while John's getting back the PowerPoint, normally we do it in person, but because of the pandemic, we are now doing actually the past year have been focusing on just basically doing it in person. I mean, virtually via Zoom. So we really appreciate your time, and at the same time, we also learned to do a lot of these doing these Zoom meetings that we've never done before.
Thanks, Kit. You know what? Just take a pause. I'm going to see if I can take control of the PowerPoint. Will that help you, John?
Sure. Okay. Let's see.
Unless you just take a minute and just go slowly on. If you want to just go ahead and start the program again. It's up to you. We trust.
Okay. Okay. There we go.
There
Let's
we
see.
go. So then next
slide. Yeah.
Okay. I'm gonna
one more.
hide the presenter view, and then okay. Let me see if I can lock it. So it's okay. Go ahead. Let's try it.
Okay. So can you next slide, please. Okay, so here is kind of like a family tree of what SMP Hawaii falls under. Basically, if you look at the top part, that's Administration for Community Living, which is called ACL. That is a federal organization. It's SMP Hawaii is part of this, and the ACL is the grantor that grants the fund 5-year grants for our program. And then right below the ACL, you see EOA, which is the Executive Office of Aging, which is under the Hawaii State Department of Health. And they whereas ACL gives the grant, and EOA will manage and administers the grant. And under the grant, our section has 4 different branches or programs. Senior Medicare Patrol, which is SMP Hawaii. We also have the SHIP, the State Health Assistance Program Hawaii. We also have the Long-Term Care Ombudsman Program, as well as the long-term care services and supports. And each program does something a little differently. And then on the other hand, the EOA also does partner with each county, and each county work with each county, and each county has an office that helps Hawaii's aging population. And in order to do all of this, we need to come together as a network and work together as a state, as a community, to help the kupunas to protect their assets, their legacy, and their dignity. Next slide, please. So here's a summary of what we do. We basically, for the 3 letters, actually, advocacy, we educate and do outreach. And there's 4 different programs, and actually SMP Hawaii is part of this. The 4 volunteer-based program works directly with individual community, residents, and communities as a whole. The SHIP Hawaii is Hawaii State Health Insurance Assistance Program. It has they train and certify volunteers, and they serve the residents. I mean, they would provide free, local, and unbiased Medicare counseling to individuals who needs help. The long-term care ombudsman program provides volunteer advocates, which serves residents in a long-term care facilities or settings. The SMP Hawaii, the Senior Medicare Patrol, have trained volunteers like me and Becca today, and we would help. Our focus is to help protect kupunas against Medicare fraud, error, and abuse. And then last piece of this segment is called the MIPA, the Medical Improvement for Patients and Providers. Basically focus on surfacing low-income English as a second language or limited English speaking population, as well as to touch on the hard to reach population, like the rural areas and so forth. And as mentioned before, that these 4 programs are funded by the Administration of Community Living Grants. And without that grant, there will not be these 4 programs. And can we move to the next slide, please? So this next slide, it gives us a brief history and story of how it evolved to become Senior Medicare Patrol program evolved. So in 1965, the Older American Act was established by the EOA. It was established, and EOA was responsible for the planning, implementation, and evaluation of the services of Hawaii's aging program. So it was established, OAA was established in 1965. At the same time, Medicare and Medicaid programs was also introduced. And then in 1977, the EOA was established. Then in 1997, 32 years after OAA was established, EOA has awarded a SAGE Watch grant, and it evolved into the Senior Medicare Patrol program of nowadays. So yeah, thus you know that SMP has been inducted for in 2 years. Next year will be 20. Like Norma said, it will be 25th year anniversary. So we're very excited about it. And so we do have SMP do have a very long history of protecting our kupunas and protecting the Medicare Trust Fund, and also protect our families and the future generation to come. Next slide, please. So here's some facts and results of what SMP or Senior Medicare Patrol nationwide does. According to the 2020's report, here's some results. There are close to 7,000 SMP volunteers nationwide, and we have contributed to about more than 500,000 hours of volunteer work, and equivalent to almost $15 million worth. And then we have also conducted about 28,000 educational events like what we did today, and reaching out to approximately 1.5 million people. So this is huge, and we're very proud of it. And then this last piece, the $2.4 million, is what was calculated as the expected savings or recoveries of Medicare and Medicaid fraud, errors, and abuses from this last year. So as you can see with these results, I don't know about you, but to me it's pretty impressive. So being a part of this winning team, we can see immediate and lasting impact because it helps save everybody's money. We all get to become kupunas, if not now, or in the near future. So this volunteer with SMP is really something that we do to protect our loved ones and the future generations to come. So next slide, please. So as a volunteer, we help our older adults fight back. We help protect their hard-earned savings, their assets, as well as their legacy. And we also being part, just this is speaking for myself personally as a SMP volunteer, I really have become much better educated about Medicare, because there are lots of information that actually we do get those information on a first-hand basis and ahead of a lot of people. So we know we get information really fast. We also, because of what we do, we learn new skills, like learning how to do a Zoom meeting today, which I've never done before, learning new computer skills so that I could do these projects. We also, being part of it is we also meet new volunteers that on a network of friends that share our interest, and together we champion the same worthy cause and give back to the community in a very positive way. And how can you help? If any of these speaks to you at all, these are a few of some of the things that we do. One is conducting group presentation like what we do today. And then there's also counselors, which we counsel individuals' cases. And if you don't want to do those things, you can also help with clerical tasks. And there's a lot of work that I'm sure Norma and the office would appreciate the help. You can also pass out SMP materials. So all volunteers are trained, whatever role that you prefer or like or have a heart, set your heart into. Norma and the group will help you, train you, give you all the information, support you all the way. You're not left alone. They kind of, and that's some of the really personal things that we get out of this. And so SMP could use more help anytime if you're interested. So next slide, please. Here's a calendar of events. Some of them has already happened. If you can, there's different dates, and these are some of there's community visual presentations that we've done over the past 3 to 4 months. We do about approximately 2 each month, and 2 or more. And usually we always partner with another volunteer. So today it's Becca and myself. And you can also see that Nora is here to support us. So you're never left alone. And she trained us and gives us best practices on how to do this too. So you learn something new. It's very exciting for me. Next slide, please. So here's the spring, summer of this year's webinars. Besides what we do, group presentation, we also get trainings, webinar trainings. We have monthly meetings. We get informed that we continually get all these informations. So here, the next slide, please. There's a continuation of the spring, summer. There's some upcoming events, and if you are interested, so we strongly encourage you to get involved or sign up for it. Okay, I believe Norma said that the fall and winter webinar or the calendar of event will be coming out pretty soon. So please also invite your friends and families to come and join us. And with that said, I would like to pass this information, well, not this presentation, to Becca. She would share more information about updates on SMP Hawaii's print and digital media program. Becca? Can you hear me?
Becca,
Yeah, no, I
think
can
might
hear
be
you.
on mute.
John, you have to let her know to unmute. Yeah.
I'm sorry.
Yep,
Sorry.
Yep. There you go.
Sorry.
Zoom mistake. I'm sorry. Good morning, everyone, and thank you to Kit for giving us a nice overview, or what I would say nuts and bolts about SMP Hawaii, how it was developed, and the history. Also about our volunteers and what the program is about and how the volunteers contribute. So moving forward, I'd like to speak with you just briefly a little bit about how SMP is getting the information out. And a lot of the information now is going out to everybody digitally or online. And so a couple of ways, oh, next slide, please. A couple of ways that SMP is creating tools and getting the message out there to the community is they've developed these nice little postcards. So prior to this year, they updated the old postcards. So I believe in the past they had about 6 postcards. Right now we're dealing with 2 postcards. So if you look at the screen, the first one here is about volunteering and general information about SMP. Okay, so next slide, please. Okay, so right now, as Kit had mentioned, there's many different roles that volunteers can help out with. We all find your little niche in regards to what you're comfortable with. So you could help with one area, you could help with 2 or more areas, just depending on your comfort level and, of course, your time. As we mentioned earlier, numerous times, the training is available for you. So you're not stepping out there alone by yourself, but fully supported. Another thing, if you look at the postcard, the one on your right, there's a picture on the right towards the bottom of one of the new guides that has been worked on. So maybe you can see this a little better. And this guide is, I have found it to be very useful. So the postcard is just announcing this new resource to you, and it's the 3rd edition. So important that the Attorney General's office has helped in updating this version and has worked with the Department of Commerce and Consumer Affairs and SMP. So it was a tri-effort or multi-effort among different offices and agencies to get the important information out to you. If it's important to you to guard your hard-earned earnings over the years, and of course your Medicare coverage and not wanting to get scanned, and we've talked about this a lot in the past presentations about why it's so important to guard your privileges with Medicare. It kind of resounded with me when I first started to hear about the different scams of going on, and how the kupuna, who are the most, could be the most affected by this, and how we can help protect them, because the scammers out there are they think of so many different ways, and I didn't know that until helping with this program on how many different type of scams there are. So if you briefly look in the book, in the guide will not only tell you about the different scams, and it's not just with Medicare. We're talking about financial, we're talking about health, there's insurance. There's a lot of different areas when we talk about scams, and it's covered in this book about how you can become aware of it and help to prevent it. Next slide, please. Okay, so I kind of talked about this and how the guide is very important, and it's resources in there that if you do need help, that there's different agencies listed in the guide that can help you. So these postcards will be going out very soon, the new ones. I'm told it's going to be distributed to approximately 28,000 Hawaii residents, and mostly in this first run, it's to the hard to reach areas or the rural areas of those populations first. But it is like we had mentioned earlier, this is to help to keep people or the kupuna or your family members safe in becoming victims to the many frauds that are out there in healthcare. And like I mentioned, it's not only healthcare, but it can be in insurance, it can be in investing. There's many different areas where the scammers are waiting to scam someone. If you need a copy of this, SMP Hawaii will be more than happy to help provide copies to you. So we can work with John, with Kaiser Permanente, to get the copies of the brochure or the booklet out to you, or we can do it directly through SMP Hawaii. Okay, next slide, please. Okay, another coming soon to you will be this postcard. And this postcard, again, talks about fraud, prevention, and resource guides and SMP Hawaii. Okay, there are many ways that you hear about why volunteering is really helpful to our community, and not just thinking of today, but thinking generations from now, or what we like to call the legacy, right? Because it's not just our generation now, but it's generations to come. I know we've heard this expression a lot. It takes a village to raise a child. SMP tweaked this a little bit, and I find it very catchy. And it's a nice little way to remind us how important working together is. And so basically, SMP, one of the quotes that they like to use, that it takes all of us or the entire state to protect our kupuna. The kupuna are very vulnerable, so we need to all step up to the plate, and let's all do our share to help the kupuna from being scammed, because it could be a family member of yours, it could be you yourself, it could be your neighbor, your friend, or co-worker, or in Hawaii, because we're such a small state, of someone you know. So it's the pono thing to try to help everyone in minimizing scams. And the postcards, like I say, will be coming out just to get that message out to you. Next slide, please. Okay, so on this slide, it's more digital marketing and information that will be coming out to you. Right now, if we look at our current events, the hottest topic for over a year has been the pandemic, which involves COVID-19. So right when this happened, about a year ago, when it started, the scammers jumped on the bandwagon as to another way that they can scam our vulnerable population. So we've been working very hard um, to try to get information out to the different populations or the community about different scams that that have been coming out related to COVID-19. And we've talked about this, I know, earlier in regards to the different type of scams, which is numerous. There's many different ones out there. If you want a refresher, I'm sure we can get information out to you on it. Next slide, please. Okay. We're taking a look now. If you look at the slide here, we're going to be talking a little bit about now the SMP website. And the SMP website has been redesigned to look nice and spiffy, a little bit more friendly, easier to use, as is always the goal when you go to websites, so you know where to go, where to click. This is the new look right now for SMP Hawaii. And basically, I know we want this so that it's ongoing, generations to come. So Kit had described earlier about how important it is because of the volunteering and why we want to be out there to help our kupuna. And we talked about the resource guide that's there. And this type of information is all here on the SMP website. If you haven't taken a look at it, please take a look at the website, and you'll find a lot of different resources there for you. SMP is always there to help you or to guide you to the right resource if it's not in their hale or in their area. Next slide, please. On this slide, we'd like to share with you some of our volunteers, some of the winning members of our winning team. If you look at the pictures, it shows the activities that the volunteers have been involved with. On the top slide, on the top, there is showing a picture of our volunteers working at some of our exhibits and being out in the community to pass the word along. Kit had mentioned that there are meetings that the volunteers have, and those are some pictures also of our volunteers at meetings. We also have volunteers on the neighbor island. So our neighbor island team is also here, our Ohana from the neighbor island. We also have pictures of the office of where some of our volunteers have come in to help with the clerical or administrative and getting the information out to the community. So if anyone is interested or needs to call SMP Hawaii on Oahu, you can reach them by calling 808-586-7281. If we're calling from the neighbor island or not from Honolulu or Oahu, we can use the toll-free number at 1-800-296-9422. Next slide, please. Okay. The question has been, and I know I've been asked, Norma had mentioned, I've been with SMP just a little bit. I'm kind of a rookie compared to people like Kit, and on the slide here, these are some of our veteran volunteers. But we've been asked, why do we want to volunteer? For me, it really resonated, like I said, when I heard the kupuna being affected and just knowing in your family or friends, you have people and you don't want to see that happen to family or friends. In the slide here, like I said, some of our veteran kupuna. On our left in that picture is Auntie May Fujii. She's one of the longest volunteers that SMP currently has. Auntie May not only volunteers with SMP Hawaii, but she also is a volunteer with SHIP. Uh, SHIP, if you, how I easily remember it is if you have seen the commercial on TV with Coach Dave Soji, Coach Vince Gu, and the broadcaster Leahy, they do a nice little commercial about Medicare and how there's assistance there to help you. Auntie May is part of that program along with SMP Hawaii. She is a retiree of the Department of Education where she was a secondary school teacher. And she also helps in many different ways. Auntie May wears many different hats for SMP Hawaii. She does a lot of the writing to help us with brochures and other writing that's required. So once again, she's found her niche, not only with SMP Hawaii, but also with with SHIP. To the right, we have Diane Sonora, who also has been volunteering a while, not as long as Auntie May, but she's been with SMP Hawaii for 6 years. Diane, when she was actively working, she was an attorney. She practiced laws concerning benefits. So very important when we're working and benefits and the laws regarding that. Diane was part of that. She's actively, like I said, been with SHIP, but she doesn't only volunteer, I'm sorry, with SMP Hawaii, but she doesn't only volunteer with SMP. She also volunteers with Kuakini Home to keep her active. Next slide, let's hear a little bit more from another volunteer. This is Eric. Eric is a volunteer, once again, veteran volunteer for 20 years from representing our island of Kauai. So Eric, again, wears many different hats in helping SMP Hawaii, but he also has worked a lot with Medicare scams, frauds. Eric also has a background when he was currently working with our Department of Labor and Industrial Relations. He also volunteers with the West Kauai Lions Club and other nonprofits. So as you can see, a lot of the volunteers that we have, including Kit, volunteer for more than one group that they feel is close to their heart. Okay. Now we'll hear from Kit. Kit, share with us about your volunteering.
Sure, thank you, Becca. I volunteer because when I became a kupuna myself, I retired from the working world. I always need to keep active. And even when I was working full time, I was also still volunteering here and there whenever I can. So right now, when I became a kupuna, I need to learn more about Medicare, and that's why I picked SMP Hawaii, because I can not only learn more about Medicare and get updated about Medicare program, I also can service other, oh, next slide, please. I can also give back to the community and serve the community of kupunas like myself. And I really enjoyed learning more about the mission of SMP Hawaii, which is to help prevent, detect, and report about frauds and abuses and healthcare scams. I found that also spending time with volunteering is really, really good balance for mind and spirit, as well as for my mind. And actually, I also volunteer. I have another volunteer with the Angels Network, which we distribute well, no, not distribute. We pack food to be distributed to people who are in need. And so I really like to say that volunteering, it really gives me balance of my mind and my spirit. And really, actually, research also has shown that volunteering is good for your health as well. So that's why I volunteer, is to give back as well as good for myself. So Becca, back to you.
Okay, thank you, Kit. For myself, I think it was very important that through my work career, when I was working, it was very important in regards to always giving back to the community, but not only giving back, but also we're lifelong learners. And with SMP Hawaii, just in the few months that I've been with the program, I've learned a lot already about Medicare, the scams, a lot about the COVID-19 scams and how wide uh, that net is in regards to what the scammers try to do. Um, so it was important for me to find something, like Kit said, to have a balance in your life, uh, to keep learning, but also to give back to your community. And like I said, when we say community, community can be your family, it can be your friends, it can be your neighbors, it can be someone you know who you know who you know. We run into people all the time, and we hear people saying, "Oh, I got a phone call," and you picked it up. And the next thing you know, because in Hawaii, we're so trusting, you listen to the caller and you start responding. And then before you know, you got caught. So part of me has made me now more aware of this, to let people know that it's not that we don't want to trust people, but you have a little guard so you know um, how to prevent from getting scammed. And to me, that's really important, and to help that most vulnerable population, which is our kupuna. Next slide, please. Okay, so we talked a lot about our meetings. So here is our meetings, where we have a meeting once a month. We gather right now virtually on Zoom. So we've been pretty good at Zoom and using technology to connect us. And so if you want to be part of our team, please get in touch with SMP Hawaii or with Norma. And right now, Norma, I'll hand it over to you.
Well, thank you so much, Becca. Thank you so much, Kit. You guys are some of the top presenters, and with your prior training from your workplaces, as well as here locally with SMP's program here, you guys are so effective in spreading the word about volunteering and beyond. So thank you so much. We're going to, this time, put on one more date on this one, and that's this Friday, April 16th from 9 to 1. If you folks have any time on your hands, come by and visit our friendly face table of volunteers and Hawaii Ship. We'll be at Kahala Mall. You'll see our table, you'll see our signs, and we are placed between Long's Drugs and Macy's. So this is Kahala Mall. I mean, we're slowly opening up the community, right? So we're taking advantage of this. And some people ask me, how do you guys report all this information, with respect to people calling in, like Becca mentioned, or, our emails, and how does this all get thrown in any kind of system? Well, what happens, John and Michelle, maybe for you folks to know too, is every month, almost every week, we're reporting this to the federal. So we have what's called an individual interaction. Any encounter with people, an email, a phone call, we note it. We note the zip code, we note it all, so that we can continue as a 5-year program. We are grant-based, like Kit mentioned, from the federal. We manage by the state, and we have contracts with the county and the different counties, the 4 counties. And so what we are doing is recording all this, reporting all this, so that when we tell our story, and we tell it every 6 months, the federal offices of ACL, Administration for Community Living, can see where we're making impact, who is calling where, what regions, is it Ka'u, is it Hawi, is it Hanapepe, is it Hilo, is it Haleiwa, where? And so when we see these hundreds of interactions, it's kind of a no-brainer to award us again another 5 years. So next year is going to be important because we'll be going into our 5th year, and you know that we'll be busy reapplying for another 5-year grant. So again, we've been here since 1997, and you can see the top-notch quality of volunteers we have. They're not just presenters. Becca does behind the scene work with our website. She does information distribution. Kit is sharing her word, her message to all different places, not just on Oahu, but she did one with Kona, and Kona's presentation involved Portland, Oregon, and California, and Kailua, Oahu. So Kit is pivotal, just like Becca, to share this word. Our mission is our message. Our message is our mission. And like Becca said, you know, while it takes a village to raise one keiki, we're all heading down that path of kupuna, and you know that we have to protect our kupuna, so it takes a whole state. And we're not talking state government. We're talking people that are lying on the beach at Hyena Beach Park on Kauai, all the way down to the southern tip of Hilo. Next slide, please. At this time, I think we're going to try and get a pulse. I know there's only a few people here, but you folks all matter. We want to know how we did today. So could you run the survey, John? It should be pretty quick because we only have a handful. Yeah. We always want to try and improve our quality. You can go to the next slide if you want, but we need the poll launched. So do you have the MS Team poll? Because I don't know how to do this, but I'll just reiterate what should be on that poll that John is launching for you. It asks you a couple of questions. How would you rate this information today? Number 1, you learned all this before, this is not new. Number 3, I learned something new. Or number 5, everything was new to me. The second question is, how would you rate Kit and Becca's presentation? Altogether, were they difficult to understand for you? That would be number 1. Number 3 is they were pretty average. I've heard kind of this delivery before. Number 5, they were pretty awesome. And be honest. And John, I'm trusting we can extrapolate the data off this, yeah? Sure. The next slide is, what's our program mission? Do you know what we're all about? Is it A, empower and assist beneficiaries, their families, and caregivers to prevent, detect, and report healthcare scams? Or is it to help you optimize your health and safety? Or is it that we are the cheerleaders for the long-term care residents licensed by the state? Is it A, B, or C? We'll give Alvin and Gwen and John, you can chime in too if you want. And I think we've come to the end. Hopefully you've polled the people here. And again, just reiterating our contact information. If you remember anything today as far as contact, just remember smphawaii.org. smphawaii.org. That'll take you to our phone numbers and everything you need. Today, as the presenters were speaking, I got a flash from my email that said, so-and-so, we don't know who he is, just gave away his Medicare number. He thought that he was confirming for vaccination, and all this person was asking for was just to confirm his Medicare number. We're going to tell you folks again, Medicare already has your number. Social Security has your SSN number. There is no need to provide any number that is your personal identification numbers to anyone on the phone or email. So right after this, you can guess what I'm going to be doing. I'm going to be talking to this resident. I don't know who he is, but this happens every hour. And so welcome to our lives at SMP OA, and we're honored to be helping all of you. So spread the word, because this is how we protect people, by spreading this knowledge. Knowledge is powerful. What questions, if any, do you folks have? We'll field a few questions if you have any. Next time around, hopefully we can close out our 4 topics. It'll be making the most of your Medicare. This one's going to be a pretty deep dive into understanding your Medicare statements. So if you or your friends or loved ones are kind of puzzled as to all the different parts of your Medicare summary notice, or what's called eligibility of benefits, or what's called your advanced beneficiary notice, all this alphabet soup will be demystified. All these acronyms will be chiseled down and smashed for you for an hour. We will go through this step by step with Kit and Becca to help you explain help you decode and help you not be puzzled about these notices so that you can compare whether you're getting the services or not and not getting scammed. So if there's no any questions, John, we want to thank you again. Thank you, Kit. Thank you, Becca. Thank you, John and Michelle, for this time around. This is our 4th month on the 3rd topic, so we had to postpone last month for unforeseen circumstances. Anything back to you, John, that you'd like to close up with? Otherwise, we're all pal.
Yeah, I just want to thank Norma and Becca and Kit for doing the presentation today, and they're they're just fantastic. Again, I just want to emphasize what they had mentioned. Consider volunteering with SMP. You know, if you have some spare time, I really think a lot of your neighbors and friends would benefit from from hearing this message from you as well. Okay,
All
thank
right.
you.
Thank you, Kit. Thank you, Becca. Thank you, John. Everybody stay safe, and we'll see you around hopefully next month. Thank you.
Okay, thanks everyone.
Thank you. Bye-bye.
Bye bye.